we're just going live. So,
Yeah, go.
yes, Dipti. ஒரு நிமிஷம் வந்துட்டா.
Um, Brenda?
Ma'am, I'll just excuse myself for a couple of minutes. I'll be back in
Carry
some
on,
time.
carry on, carry on. Don't worry.
We'll be able to make her co-host, na? Parul?
एक मिनट, I will just make
हाँ, पारुल
दीप्ति
को
को मैं
host
host बना देती हूँ.
हाँ, दीप्ति is there, दीप्ति को बना दो, हाँ. To change her name first.
Yeah, I'm just making Deepthi host,
Uh-huh.
so Deepthi will be able to handle. Okay.
Dipti is there.
You're okay otherwise?
Yeah, there is
Okay,
some guest. Dipti, please, if you're there, rename yourself. I don't know why I'm not able to. This is the first thing Rashmi I did in the morning. I sent her the link, and within 4 minutes she was happily wishing good morning and looking forward. She had message. Again, I have sent the link. Let's see, doctor.
It's okay. Even if no one comes, it's the 1st of March. We are always ready to answer questions. What's the temperature in Delhi now? Girls?
Rashmi, unmute.
Unmute.
तापमान 26 डिग्री सेल्सियस है।
Okay.
न्यूनतम
अच्छा.
तापमान 15 डिग्री होने की संभावना है।
Thank you.
बता दिया.
ये कौन बोला?
I didn't hear that. What was it?
I know.
आज 26 डिग्री
AI. Alexa.
ये ना आजकल सारे काम एआई पे करने लग गई हैं।
Uh-huh.
चाय नहीं पिलाता
बिल्कुल
यार.
टेक सेवी फुल
Dipti, you're looking so nice.
कॉपी करने की कोशिशें हैं.
I'm not able to hear what happened. What is it?
AI ma,
AI.
Parul ma, I think got logged out. Dr.
यही
Priyanka,
तो
I
हूँ.
can see.
है ना.
Ma hai? I can see ma.
हाँ.
माँ नहीं पारुल की बात कर रही थी वो पारुल भी
हाँ.
है मम्मी
Parul
पारुल
is
है
there. हाँ, Parul है. मैं माँ को देख रही थी. माँ ने
तो
देखी. I have. Good evening, Dr. Priyanka. You're there.
Yeah.
I don't know what has happened to my view.
Why is Rashmi Agarwal saying the link is invalid?
She needs to restart her device.
Everybody is putting onto that.
Dipti, please help them.
It's the same link. We have never
Yes,
changed.
good evening, Dr. Priyanka. We can't hear you. No, Dr. Priyanka, you need to unmute yourself.
No.
You're showing muted here.
Yeah.
Not even your video is on, so we can't see and hear you. Once you join the meeting, you would need to join with the permission of audio video. Would you like to rejoin, Dr. Priyanka? We need to request you to rejoin Dr. Priyanka. So that is the part of our sessions now. If any technical glitch in the beginning, we know that session is going to go very good.
Tammy, have you told her to exit and rejoin?
Yes, ma'am. Dr. Priyanka, can we request you to log out and join once again?
सैमी क्या हम चैट बॉक्स में लिखते हैं कहीं वो हमें सुन भी
Yeah,
ना पाए तो?
I have messaged her also. No.
जी
I think she's you're online with her?
She is able to message. She has messaged in chat box, so I have told her not audible.
Okay.
Rejoining. She's rejoining.
Any issues, Dipti?
Yeah, she will be rejoining. She has resolving the voice issues and she'll be.
No. Okay. Yeah, live.
जी जी.
Someone is saying that the link is not working.
No. So they need to restart the device.
Dipti, I'm reclaiming host.
Yeah.
Shall we admit everyone? In it's already 5-6.
I guess we can. We just
कर
wait.
लेते हैं ना admit सबको उसके बाद ही.
Yes, it's okay. I think that's
Yeah.
the comfort with being with Humsafar family. So luckily, I think link worked, madam. I don't know, Parul, you'll agree or not, but sometimes I feel technology is also, given us some sort of, training in having patience.
जी बिल्कुल वो
हाँ?
हमें शांत रहना सिखाती है.
We might not bear with each other's shortcomings, but when there's a network glitch, we all patiently waiting and smiling.
शायद ये इसीलिए है कि हम कुछ देर और एक दूसरे को देख सके बातें कर सके.
Yeah,
और ये
And-
मार्च का महीना भी तो है समीक्षा.
absolutely. The spring has started to come in.
जी
And I only see blue and yellow color in March, right, Pritama? I hope the kind of patience we show to AI, we are able to show each other also in life.
बिल्कुल.
So nice to
With
see
a
us, Sharon.
smile.
Yeah,
Patience with a smile. Because
exactly.
you know, somebody might be taking a picture, by the way.
I know. I swear.
Dipti will do that.
Can somebody, is anybody on call with her? Can you give her a call?
Yes, ma'am.
But she did come in.
She's joining, ma. She messaged me WhatsApp also and otherwise also that she's
Okay.
trying to
Okay.
resolve the voice issues and rejoin.
अगर समीक्षा आप चाहें तो आप जब तक उन्हें संपर्क करती हैं, हम कार्यक्रम आरंभ करते हैं माँ के साथ, और रश्मि जी हमारे साथ हैं।
Yeah, that's a better idea.
ये
Absolutely.
एक अच्छा
Absolutely,
समय है मार्च के बारे में बात कर लेने का।
absolutely, Parul. Please go ahead. I'll call.
जी जी जी। तो दोस्तों नमस्ते, मैं पारुल, मैं स्वागत करती हूँ आपका हम आज के हमारे इस शनिवार के सेशन में। मार्च का महीना, पवन करे शोर, एंड डीएसएफआई करे उससे भी ज्यादा।
Hello.
जी
Yeah.
Hello.
जी।
So Priyanka's coming.
Yeah.
Hi, good evening, all. Am I audible?
Yes, you are.
Perfect, perfect.
You're
Sorry
audible
for
and
the
visible.
glitch.
So
So,
Yeah,
Parul,
I
this
think
was
we are-
required. The beginning from you was required, and everything, clicked. Yeah.
Thank you for your patience. So, allow me to introduce myself. I'm Dr.
Dr.
Priyanka.
Priyanka, we will
नहीं,
start the
करने
session.
दीजिए, करने दीजिए।
Yeah. So, I'll keep it very quick. I'm sharing my screen right away. Just allow me a minute, please.
Actually, we have a little
Okay.
ritual here that Parul will introduce you first,
Yeah,
then
sure.
I will, and then we will go
Yeah.
full-fledged Dr. Priyanka Sharma today. Parul, by the time
जी
I try to give her
जी
co-host
जी
right.
समीक्षा, तो जैसे कि मैं बता रही थी, ये मार्च का महीना है, और मार्च में 21 मार्च को विश्व डाउन सिंड्रोम दिवस के रूप में मनाया जाता है, जो पूरे देश में क्या पूरे विश्व में डाउन सिंड्रोम के लिए जागरूकता फैलाने के आयोजन इस दौरान आरंभ हो जाते हैं। भारत में इसकी अगुवाई करता है डाउन सिंड्रोम फेडरेशन ऑफ इंडिया। मार्च आते ही हम डॉक्टर रेखा रामाचंद्रन के मार्गदर्शन में अपने अपने स्तर पर, अपने अपने स्टेट में, अपने अपने संस्थानों के साथ मिलकर जागरूकता फैलाते हैं। सेल्फ एडवोकेट्स और उनके केयर टेकर्स की यथासंभव सहायता करने की कोशिशें करते हैं। हमारे कुछ एक कार्यक्रम हैं जो आज से ही आरंभ हो चुके हैं। इनकी जानकारी आप हमारे व्हाट्सएप ग्रुप्स पर या वृंदा जी से ले सकते हैं। जैसा कि मैंने कहा, ये मार्च का महीना है, और इस दौरान हमारे खून में रवानी कुछ और ही होती है, कुछ जोश हमारा और ही होता है। जैसा कि आप स्क्रीन पर भी देख सकते हैं, हंसते मुस्कुराते मेरे दोस्तों को। तो आज मार्च के इस महीने में जरूरी हो जाता है कि मैं अपने कुछ दोस्तों से आपको मिलवाऊं। सबसे पहले मैं स्वागत करती हूँ डॉक्टर रेखा रामाचंद्रन का, फेडरेशन की प्रेसिडेंट है और हमारी मार्गदर्शक हैं, हमारी माँ है। माँ, आपका स्वागत है, बहुत धन्यवाद आपका आज के सेशन में आने के लिए। उसके साथ ही डाउन सिंड्रोम पेरेंट्स सोसाइटी की प्रेसिडेंट दिल्ली से रश्मि जोशी जी हमारे साथ जुड़ी हुई हैं, और डीएसपीएस से ही हमारे साथ मेरी दोस्त समीक्षा तो है ही, उन्हें भी मैं आमंत्रित करती हूँ। दीप्ति माथुर जी डीएसपीएस से हैं दिल्ली से, उन्हें भी मैं आमंत्रित करती हूँ स्क्रीन पर। तो बहुत सारे मेरे दोस्त मेरे साथ हैं, और आप सबका साथ तो हमारे साथ है ही। आज हमारे साथ जो हमारी मेहमान हैं, इस तरह के लोग, इस तरह के डॉक्टर्स हमारे लिए वरदान साबित होते हैं, जब वो अपने आप हाथ बढ़ाकर आते हैं और हमें कहते हैं कि हम आपके साथ हैं। हमें ये दुनिया कुछ और खूबसूरत लगने लगती है, और अपने बच्चों के लिए कुछ और सपने हम सजाने लगते हैं कि इस दुनिया में हमारे बच्चों की भी एक जगह होगी, एक रुतबा होगा। तो आज डॉक्टर प्रियंका शर्मा जी हमारे साथ हैं, जिनका विधिवत परिचय कराने के लिए मैं आमंत्रित करती हूँ समीक्षा को।
Yes, thank you so much, Parul, and good evening, everyone, and welcome to today's session. And thank you so much for bearing with us for that initial few minutes. And we are happy that we are together here on the first. So, as Parul rightly mentioned, March brings in, a lot of enthusiasm in the community because it has the World Down Syndrome Day in it. So, 21st March we celebrate every year, and today being 1st March, we are quite enthusiastic about it. So coming back to today's session, we are going to talk about the biggest human organ, which is in direct contact with our external environment and climate conditions. Yes, the skin. It not only protects our body, but also regulates temperature, helps us feel anything and everything what comes in contact with it, and much more. As parents of persons with Down syndrome, we do understand that our self-advocates may experience or can be prone to many dermatological conditions. And there are, along with the diagnosis, due to the combination of immune and genetic dysregulation and insufficient physiological processes also it happens. So in today, our expert is going to throw light on common to complex skin issues our champs can encounter in their life. So how as parents, we can manage it when we to seek support from the expert, and what all treatments are available to address those concerns in the area of medical system she is trained and have expertise on. So today we have with us, as Parul mentioned, Dr. Priyanka Sharma, Director, Chief Dermatologist and Hair Transplant Surgeon at V6 Clinic at Gurugram. And a little information about her. She received her medical degree from Indira Gandhi Medical College in Shimla and GMSH in Chandigarh, her MD in dermatology. And she graduated with the MRCP in dermatology from the Royal College of Physicians in Edinburgh, United Kingdom. As a mark of her exceptional expertise and commitment to her field, she also holds MNAMS. If I were to read all her credits, Parul, it would take the entire evening due to her intense dedication and enthusiasm for her field. So now, actually going in detail, just wanted to say that she makes certain that every patient she sees feels supported and heard. Her devotion to improving patients' care and dermatological science is further demonstrated by her role as a reviewer for the International Journal of Dermatology, which furthers her commitments to research and innovation. Good evening, Dr. Priyanka. It is indeed a great pleasure to have you among us. Very warm welcome. We all are eagerly waiting to understand the skin issues our champs might face, to know how we can be vigilant about the symptoms so that early detection, management, treatment, and cure can be sought. Also, what all treatment options are available nowadays. Thank you so much for instantly agreeing for giving your precious time for this session. Over to you.
Thank you so much for the kind introduction, and pleasure is all mine. I was on the lookout for associating myself with, organization with such a noble cause, and it just so happened that we instantly connected. So I would say pleasure is all mine, and I'm so looking forward to contributing my bit in all the possible ways and best of my capability. So let me just start off by this presentation, which again I prepared on a short notice. So if you allow me a minute, I'll
Yes,
try to
please.
prepare my screen.
Yeah, yeah.
I hope my screen is visible.
Yes.
All right.
Yeah.
Uh, Sorry. So today I'm going to speak a little bit about understanding and managing the skin changes in Down syndrome. And please consider it as a practical guide. I'll be probably be throwing medical jargon because I can't help it, but I'll keep it as generic as possible. So let me just start off by what is the content of this presentation. I want you to be educated about, first of all, why do we need to understand so many skin changes in Down syndrome early on, and why not to ignore these skin changes, why the skin changes are so common, what are the red flags that you should know, and some tips, some basic lifestyle modification to mitigate through this and avoid the complication. Also, a little bit of how frequent we should seek a professional dermatologist, or dermatologist screening or analysis is what we call, at various stages of child's life. So coming on to why do we need to understand the skin changes in Down syndrome? May I know if everybody is comfortable with English or Hindi or English, or should I just go on
हाँ
with English?
डॉक्टर प्रियंका, अगर आप जो आपकी प्रेजेंटेशन है वो आप इंग्लिश में रखिए, जितना आप इंग्लिश बोल सकेंगी अच्छा रहेगा। और हिंदी के लिए यहाँ मैं हूँ, अपने दोस्तों के लिए हिंदी में अगर कुछ ट्रांसलेट करना पड़ेगा तो मैं यहाँ। शुक्रिया।
Sure, right. So I will keep it English because that's more of my style when I talk to people.
बहुत अच्छा।
Okay, why do we need to understand skin changes in Down syndrome? First of all, these subset of categories where we call as chromosomal disorders, they have a unique set of skin changes. So when we talk of typical skin conditions in these people, they are very easy to diagnose. So my job here is to educate the caretakers and parents to all these for all these unique skin characteristics, so that they can diagnose it early, and early intervention all is half the diagnosis, as we call. So, and also there are changes across different age groups. जब हम neonate की बात करते हैं, जैसे कि first 1 month of the life, तो जो skin changes होते हैं वो entirely change हो जाते हैं different age group से. So that's why we need to sensitize ourselves and be aware of the whatever changes we expect in a particular age group. And very simple lifestyle modification as basic as skincare routine, अगर वो rightly apply करते हैं तो it prevents most of the complication that can be to some extent very morbid. Now, why not to ignore the skin changes? As we know, skin is the mirror of the body and skin is the armor of the body. Skin is the largest organ of the body, as ma'am said, and whenever there is a breach in the skin, जब भी स्किन पे एक माइक्रो टीयर भी पड़ता है, the skin calls for germs. The germs, it makes a perfect portal of entry for all the germs and infections. Even whatever product that you apply, which is normally considered safe, these products can often impose certain allergic reactions or irritant reaction when there is a breach in the skin barrier. Also to mention, skin एक अपने आप में एक thermostat है. It has a thermoregulation function. So it senses the environment and it adjusts the body's temperature accordingly by sending some feedback signal. So whenever there is a dysregulation in the skin, this again leads to so many of the changes which caretaker or parents of child may should be aware, and if they are not aware, it may be somewhere frightening to see those changes. स्किन अपने आप में एक इम्यून ऑर्गन है, मतलब वो अपनी आपके जर्म्स को और इन्फेक्शंस को फाइट करता है. सो जब भी स्किन अफेक्ट होती है, immune dysregulation hota hai, and most of these infections that we see, the secondary infection that we see, is the result of that. Now, why skin changes are more frequent? There's a lot of science behind it. A recent survey showed that almost 56% of children associated or with this trisomy, they have some or the other dermatological issue. But again, all the dermatological issue are not red flags, and that's why it's very important for all of us to understand that while some changes are a normal occurrence and nothing to be scared of, some changes definitely call for early intervention and a professional help. Immune dysfunction and structural skin changes or genetic dysregulation are by and large the core of why we see more skin changes in people affected with trisomy or Down syndrome. Just as we have delay in the development milestone, skin also has certain milestones. So you assume it as a lag in the skin development milestones. Now, coming to what all skin changes we often encounter. Okay, first is the skin phenotype. When I say phenotype, that means that these children may have a certain specific set of characteristics that I'm going to discuss ahead. Some key skin telltale sign, which I'm going to keep it very generic, and you can probably identify these basic signs suggestive of a particular pathology. Now, skin changes, as I discussed, may shift from one age group to another age group entirely. So we need to know what to expect at what age group. And also, we need to differentiate what skin changes are transient, so nothing to be worried of, and some skin changes are actually long term and they require a lot of lifestyle modification. Similarly, we definitely need to differentiate false alarm versus alarming skin condition. Talking of the characteristic skin type, we often find very soft or gentle features, more of a rounded face, small eyes, low set ears, flat nasal bridge. Now, I've put some characteristic images over there, which apparently may seem like a big deal, but these are completely harmless. All we need to do is be aware of it and follow some basic measures to avoid some complications associated with it. Now, if you see the first image over here, we call it as nuchal fold or the neck fold. So children or neonates born with the Down syndrome may have an extra fold of skin over the back of the neck that may improve with age as the child grows. So nothing.
Ma'am, if you're showing any image, it is not
Yeah,
visible
we are
right
not
now.
able to see that.
Okay.
Yeah.
Yeah, now
Now-
it's better, ma'am. Thank you.
So far my slides were visible just to
Yes, absolutely. They were moving.
So far, they were
enough.
visible, only these images weren't.
Yeah,
All right. So I'll try again. I'll put it on play. Just please tell me if it's visible now. Is it visible?
Yes, ma'am, it is.
Okay. All right. Perfect.
Thank you.
So, the first image over here shows extra fold of skin on the nape of the neck, what we call as a nuchal fold in medical language. It's completely okay, nothing alarming. It may improve with age as the child grows, but this is one of the characteristic sign that people should be aware of. Coming on to my second slide, I don't think my cursor is visible over here. I'll zoom out again. Okay, so can you make out these white spots on the colored part of the eyes over here? Can I get a
Yes.
yes or
Yes, yes.
Yes, ma'am.
Yes.
Yes.
so sometimes, and I often, whenever I, deal with some of these sort of activities where we have health checkups and camps like that, people, they get scared by the sight of these spots as if this is going to affect the eyesight. Rest assured, these are called as Birchfield spots or eye spots. These are completely harmless, and one should be aware of this finding, but at the same time you shouldn't be bothered about it. Just to make you aware of this finding, I put in an image. Second is this fold over here. It's again a common occurrence in most of the ethnicity and a very characteristic phenotype, nothing to be worried about. This single palm crease again is one of the most common and characteristic finding, nothing alarming. Now, what is to note here is the bigger and fisher tongue that we often find in such children. Nothing to be worried except that this is associated with mouth opening, and sometimes there is a drooling of saliva and secondary infection. So we have to be on the lookout for if there is any fissuring at the angle of the mouth because of this, and because there is a fungal infection called as candida, which is very commonly associated when a child is constantly keeping the mouth open. Moving ahead, these are the common set of skin conditions that we see. Most of you may be aware, but I'm just going to run, a slide of what all skin infections we can come across. One is, skin conditions we can come across. One is increased susceptibility to skin infection, reason being immune dysregulation. Then the dermatitis. Dermatitis is a very generic term. Wherever skin is breached and inflamed, we call it as dermatitis. So there are three classical type of dermatitis we see in child with Down syndrome. That is more prevalent in these individuals as compared to the general population. Also, the prevalence is of autoimmune disorders, especially the alopecia areata. We call it as alopecia in general language. This is very commonly seen in people. Skin changes associated with metabolic issue. Now, this is very apparent as the child grows and the child enters a period of stage of adulthood. There are some peculiar skin conditions I'll discuss ahead, and also premature skin aging is something we see in adulthood. Okay, I put in a few images just to show this is not to scare you. Again, this is just to make you aware. If your child has any of these bumpy, red, pustular or pus filled lesions and the child is crying excessively, this definitely calls for attention. This may be a sign of what we call as a staph infection. It's a kind of bacterial infection. So image 1 and 2 is a very classical of boils, staph infection, and this require either a short course of topically applied antibiotic, or sometimes the oral course of antibiotic. To my right is a fungal infection, which again it's on the rise when the immune dysregulation is associated pathology. Is my screen visible?
Yes.
Yes, all right. Moving on to next image, this is a very classical finding of fungal infection of the nails. So in case your child has whitish discoloration affecting most of the nails, or one or two nails, this is very classical of fungal infection. Mostly there is a candida, which is a yeast involved, but non-candidal infection nowadays in the past decade is on the rise, and that have to be dealt in a more rigorous way. Again, this is an infection which has gotten a super infection. So when you ignore the boils or tiny bumps over there, sometimes there is super added infection that complicates the case. So any such bumps definitely calls for attention. Moving on to another peculiar and very common occurrence in Down syndrome is what we call as cradle cap in generic language, and it's called as seborrheic dermatitis in medical language. What you see is those yellowish crusts, which often almost fills the whole scalp, but it's not just limited to the scalp, but it may also affect face, sometimes the neck, sometimes chest, and even the groin area. Like in this image, this is a classical finding of how on the face seborrheic dermatitis may present. The folds and the chest and upper back is a very classical seborrheic sites where typically the oil glands are in generally they are concentrated, and this calls for superadded malassezia or yeast infection. Coming on to autoimmune and inflammatory disorder, in Down syndrome, we see alopecia areata very commonly. There may be an increased incidence of vitiligo, which we call as fulvari or white spots. Elastosis, that means your elastin, which is a protein which gives the skin lift, it mostly is fragmented. So you have a poor quality elastin, and that shows as a wrinkly skin. Then there is a thickening of the palms and soles. Now, this thickening can be sometimes yellow, sometimes orange. That definitely calls for attention. Inflammatory skin disease such as psoriasis, there's a condition called as pityriasis, which it definitely is more associated with Down syndrome. Now, one interesting fact or one interesting association I would like to share is anyone who has got even a slightest roundish patch on the scalp as alopecia areata, there is a very common occurrence of thyroid disorder, Hashimoto thyroid disorder associated. So even if we are able to manage alopecia areata through topical or oral medication, we should always refer to the child to an endocrinologist or medicine doctor or physician to check for underlying thyroid issues. So thyroid and celiac is invariably commonly associated internal disorders, which sometimes are associated with autoimmune skin disorders. Okay, so I've tried to segregate these disorders as per the age group so that people or caretakers or parents who are in the respective age groups may relate to it, or at least be prepared for what changes do we expect or what changes are commonly seen in what age group. So broadly, we categorize the age groups into neonate period, which is from birth till 1 month. Then infancy is 1 month till 1 year. Childhood, we call it 1 to 10 years. Post that, there is a teenage, and after 19 years there is adulthood. In neonatal period, in general, the skin is quite immature and skin is preparing itself till another 1 year. Skin itself is more susceptible to environmental changes, and that is even worse in cases of Down syndrome, I would say. So we have to be extra gentle in neonatal period. Out of all the age groups that we just discussed, there is invariably dry to irritated skin. So you have to be very mindful of whatever goes on baby's skin. At this time, even seemingly harmless oil can cause a lot of irritation, and I've seen such cases more often than not, wherein apparently harmless product that is being applied to the skin can has led to a lot of irritation, redness, and a state of acute skin failure, which is often very hard to manage. Like I said, skin is a thermostat in itself. Sometimes we do see some of these color changes, which are bluish to reddish, which scare caregivers or parents. Which these are typically transient. I'm going to show the changes in the slides ahead. So, what you expect in neonatal period is dry skin, some reddish, irritated skin or rash, you can say. Another very common finding is small whitish to yellowish bumps on the face. This is neonatal acne. And neonatal acne have all the way different pathology than the acne or bumps or pimples that we see in adult. The reason being, it's mostly fungal, the same fungus which is causing the cradle cap and seborrheic dermatitis. So this falls in the same spectrum. The management is entirely different, and any dermatologist, experienced dermatologist would be able to treat it, and the line of management is entirely different from the other acne. Neonatal cradle cap, we just discussed. This is a very common occurrence. This may be localized to a part of scalp or may extend to whole body. Now, this I want everyone to take note of. I have had a couple of parents who are scared by the sight of these changes in children on their neonates, but this is, rest assured, to be it's very transient. This is because the baby's thermostat, skin thermostat, is still not mature. So the oxygen flow amongst the capillaries, among the vessels, is not that mature. That's why the blood, deoxygenated blood, it tends to stay for a little longer in the acral areas. By acral areas, I imply feet and hand. and sometimes this is a marbled skin appearance. Again, it is very short lived. This typically settles as the baby grows, and you have to, I mean, there's no active intervention you have to do. But again, you have to be educated and sensitized of these changes, as this is not a red flag at all. Moving on to some parental care tips at this stage. Be very picky with your moisturizer, with your cleanser, with your, even with your soap. I always recommend, and that is a standard recommendation, to use fragrance free cleansers and of standard brands, not to try any home remedies at this point. Try to keep the water temperature for bathing as neutral, close to lukewarm to neutral warm as possible. Again, similarly, use a fragrance-free moisturizer twice a day, since the skin is already dry, and that the requirement may vary from season to season. Winters call for intense moisturization in such neonates. Always use a cotton clothes. Do not use other fabric. Cotton is the standard. Loose cotton clothing is what is recommended to minimize the irritation, and at the same time, avoid long shower, because this strips off all the natural skin oils. Now, here are some don'ts that you need to follow and need to remember. You need to avoid hot water shower, scented products. Even the mustard oil is a big no. Avoid rigorous massaging. Avoid exposure to extreme temperature. Let me show you how to remove the cradle cap at home. We always have to
डॉक्टर
check.
प्रियंका, क्या आप ये डूज एंड डोंट्स एक बार हिंदी में भी रिपीट कर देंगे?
Yeah. Let me go back to the slides. All right. Okay. So do's, हमेशा आप फ्रेग्रेंस फ्री बेबी प्रोडक्ट्स यूज करें. सो बेबी प्रोडक्ट्स, देयर आर सम गुड ब्रांड्स. इफ एनीबडी इज जेन्युइनली इंटरेस्टेड, देयर आर स्टैंडर्ड ब्रांड्स व्हिच मेक बेबी प्रोडक्ट्स जो कि फ्रेग्रेंस फ्री है. फ्रेग्रेंस फ्री का सिंपल मतलब है उसमें कोई फ्रेग्रेंस नहीं होनी चाहिए, चाहे वो रोज है, चाहे वो जेंटल क्यूकुम्बर है, whether it's wet wipes, whether it's cleanser मतलब the body wash, soap. हमेशा फ्रेग्रेंस फ्री बेबी क्लेंजर्स और मॉइस्चराइजर यूज करें. कॉटन फैब्रिक, एनी अदर फैब्रिक, सिंथेटिक फैब्रिक को अवॉइड करें. कॉटन फैब्रिक ही पहने, और लूज कॉटन फैब्रिक. क्रेडल कैप, जो आप येलो कलर का क्रस्टिंग जिसको हम कहते हैं, क्रेडल कैप इज अ जेनेरिक डायग्नोसिस, उसको रिमूव करने का एक बहुत ही बेसिक एट होम तरीका है. वो मैं आपको बात दूसरी साइड में बताऊंगी. क्या नहीं करना है, आपको बच्चे को लॉन्ग शावर नहीं देना है. कई बार लॉन्ग शावर, हॉट शावर नहीं देना है, और आपको मस्टर्ड ऑयल और कोई भी घर का देसी कंकॉक्शन नहीं लगाना है. कोकोनट ऑयल इज द सेफेस्ट ऑफ ऑल. आई हैव सीन कोकोनट ऑयल से भी बच्चों को रिएक्शंस देखी हैं, बट आउट ऑफ ऑल द ऑयल जो घर पे हम ऑयल हमारे पास होता है, कोकोनट सबसे सेफ है. जब भी बच्चे को ऑयल लगाना है, मसाज करना है, डू नॉट रब इट. रिगरसली मसाज नहीं करना है, और हमेशा पानी का टेम्परेचर ल्यूकवार्म रखना है, ना बहुत एक्सट्रीम ठंडा, ना बहुत एक्सट्रीम गर्म रखना है. सो अगर ये बेसिक नियोनेटल स्टेज पे पहले 1 महीने में अगर ये टिप्स फॉलो करेंगे, बॉडी का जो नेचुरल ऑयल है वो रिटेन रहेगा, और आपका जो स्किन का बैरियर है वो क्लोज टू नॉर्मल रहेगा. नाउ मूविंग ऑन टू, इज माय स्लाइड विजिबल?
जी बिल्कुल देख पा रहे हैं.
अब ये क्रेडल कैप को कैसे रिमूव करना है. कई बार पेरेंट्स उसको प्लग करते हैं या फिर कोम से निकालने की कोशिश करते हैं. अगर आप ड्राई स्कैल्प पे, या फिर एक जब क्रेडल कैप बिल्कुल स्किन के सरफेस से अडेयर होता है, चिपका होता है, और उस टाइम पे आप उसको कोम से निकालने की कोशिश करते हैं, वहां पे रॉ एरिया बन जाता है, जख्म बन जाता है, एंड इट इनवेरिएबली 100% ऑफ द टाइम इट कॉल्स फॉर सेकेंडरी इन्फेक्शन. तो उसमें हमारे जो बैक्टीरियाज हैं, जो नॉर्मली हार्मलेस भी होते हैं, जो हमारी स्किन का एक पार्ट है, वो भी उसमें इन्वेड कर जाते हैं, एंड देन द सिचुएशन बिकम्स मोर कॉम्प्लिकेटेड. सो मार्केट में बहुत जेंटल बेबी शैम्पू हैं जो कि इसी पर्पस के लिए फॉर्मुलेटेड हैं, जिनमें सल्फेट्स नहीं है, पैराबिन्स नहीं है, एट द सेम टाइम बहुत ही जेंटल सर्फेक्टेंट है. आप वो यूज करिए. एक बहुत ही अच्छा तरीका होता है, कोकोनट ऑयल को हल्का सा वार्म करो और उसको अराउंड हाफ एन आवर के लिए आप स्कैल्प पे छोड़ दो. उससे ये क्रेडल कैप का जो क्रस्ट है, क्रस्ट इज द हीप्ड अप थिंग दैट वी कॉल, वो लूज हो जाता है. देन यू कैन जेंटली रिमूव इट विद योर फिंगर्स एंड और सॉफ्ट कोम. जब भी आप कोम यूज करें, मेक श्योर वुडन कोम यूज करें और उसके जो टीथ हैं वो बहुत शार्प ना हो. सो दे आर कोम्स अवेलेबल इन द मार्केट जिसके ब्लंट टिप होते हैं और वो बहुत ही इफेक्टिवली इस क्रेडल कैप को रिमूव कर सकते हैं. एंड देन यू फॉलो इट अप विद अ मेडिकेटेड लोशन व्हिच द डॉक्टर रिकमेंड्स इफ द क्रेडल कैप इज सिवियर. So this is very important for parents or caretakers of neonates to note. Now coming on to skin changes in infancy. Infancy में while the skin is still dry, breached, but there are some other sets of skin conditions which again add to the whole thing. एक्जिमा. एक्जिमा एक बहुत ही जेनेरिक और अम्ब्रेला टर्म है. एक्जिमा और डर्मेटाइटिस हम बहुत ओवरलैपिंगली यूज करते हैं. एटोपिक डर्मेटाइटिस इन्फेंसी में अपने आप को फोल्ड करती है, अनफोल्ड करती है, जिसमें आपको ड्राई, इची, रेडिश रैश होता है, जो कि या तो नेक के फोल्ड्स में या आपके बाजू के फोल्ड्स में, एल्बो के फोल्ड्स में, नी के फोल्ड में बहुत कॉमनली देखने को मिलता है. एटोपिक डर्मेटाइटिस इन्फेंसी में एक बहुत ही कॉमन अकरेंस है और जब तक बच्चा बड़ा नहीं हो जाता उसकी सिविरिटी वैसी ही रहती है. इन टीनेज और एडल्टहुड एटोपिक डर्मेटाइटिस की सिविरिटी खुद कम हो जाती है. ऑल्सो इन्फेंसी की स्टेज में एक समझने वाली और नोट करने वाली बात यह है कि बच्चे को सेंसेशन ज्यादा फील होने लग जाती है. नियोनेट में चाइल्ड में क्राई मोर इफ ही और शी इज अनकंफर्टेबल. इन्फेंसी में बच्चे को अर्ज हो जाती है स्क्रैच करने की. सो चाइल्ड इज ऑफन रेस्टलेस दैट वी सी. And sometimes, there is until the time you soothe that area with moisturization and skin is dry, irritated, child cries excessively. So this is definitely one condition to assess the severity of the atopic dermatitis. If the child is crying persistently, that means the itching is severe and we definitely have to intervene and add the topical anti-inflammatories and moisturizing emollients. इस स्टेज पे डायपर रैश काफी कॉमन होता है. बच्चों को फंगल इन्फेक्शंस के रिस्क ज्यादा रहते हैं. एंड लेट मी शो यू इन द इमेजेस अहेड. देयर इज अ कंडीशन कॉल्ड एज कैल्सिनोसिस, जिसमें छोटे छोटे व्हाइट कैल्शियम के डिपॉजिट स्किन में सेटल हो जाते हैं, which is nothing alarming, but it definitely is sometimes parents get apprehensive. So this is a very classical picture of diaper rash that we see. ये क्यों होता है? क्योंकि डायपर में कॉन्स्टेंटली ह्यूमिड कंडीशन होती है जिसकी वजह से हमारा वहां पे कैंडिडा विच इज अगेन अ फंगल यीस्ट वो ज्यादा ओवरग्रो कर जाता है. सो दिस इज हाउ अ टिपिकल डायपर रैश लुक्स लाइक. These are calcium deposits. We call it as calcinosis cutis. This may unfold itself in the infancy stage. Very characteristic calcinosis cutis that we see. Nothing alarming, nothing to worry. This may happen. Why it happens is not very clear, but this has nothing to do with the other alarming calcinosis features that we see in adults, which are mostly associated with kidney failure and some metabolic disorders. Now, इस स्टेज पे आपको क्या करना है? Do's and don'ts. Again, the do's in context of what to use still remains the same. Fragrance-free products is the key to avoid any further skin irritation. कोई सेंटेड लोशन जो मार्केट में कॉस्मेस्यूटिकल्स कंपनी काफी प्रमोट करती है, यू हैव टू अवॉइड ऑल ऑफ दैट. स्टिक टू फार्मास्यूटिकल्स, बेबी और pediatric based products which are standard products for atopic skin individual. They are good one in the market available and very effective. And ऑलवेज प्रेफर सेरामाइड बेस्ड मॉइस्चराइजर. तो जब भी आप मॉइस्चराइजर ले मार्केट में, उसमें अगर सेरामाइड्स और कुछ ऐसे हीलिंग इंग्रेडिएंट्स होते हैं जो कि रिपेयर भी करते हैं और मॉइस्चराइज भी करते हैं, तो आपकी स्किन की हीलिंग को वो फास्ट करते हैं. आपको सॉफ्ट क्लोथिंग, बेडिंग, ये सारी कॉटन की होनी चाहिए. लूज ब्रीदेबल क्लोथिंग होनी चाहिए. डाइपर्स को कैसे फ्रिक्वेंटली चेंज करना है, आई विल टेल यू इन कमिंग स्लाइड्स. अब क्या नहीं करना है इस स्टेज पे? डिटॉल, सैवलॉन, कोई भी ऐसे सोप और या फिर कुछ लोग पानी में डिटॉल डाल देते हैं कि बच्चों को इन्फेक्शन ना हो, ये बिल्कुल ना करें. हॉट वाटर बाथ अवॉइड करना है, सेंटेड प्रोडक्ट्स अवॉइड करने हैं. ऑल ऑफ दीज प्रिकॉशंस स्टिल रिमेन द सेम. नाउ जब भी हम डायपर खरीदें, प्लीज मेक श्योर कि उसका मटेरियल ब्रीदेबल हो. उसका मटेरियल अगेन देयर शुड बी नो फ्रेग्रेंसेस, नो पैराबेन्स, नो लेटेक्स. और आजकल ऐसे डायपर्स भी अवेलेबल हैं जिसमें वेटनेस इंडिकेटर होता है. सो इफ द so that helps you to to indicate when to change the diaper so that वहां की स्किन बहुत सॉगी ना रहे और वहां पे कैंडिडा ओवरग्रो ना करे. क्या अवॉइड करना है डायपर्स में? प्लास्टिक और सिंथेटिक डायपर्स मटेरियल्स एंड फ्रेग्रेंस, और जिसमें लोशन इन्फ्यूज हो, उससे बच्चे को एलर्जिक रिएक्शंस होने का चांस और सेंसिटिविटीज होने का चांस ज्यादा रहता है। एडिशनल टिप्स, हर 2-3 घंटे में यू हैव टू चेक इफ द बेबी हैज सॉइल्ड द डायपर एंड इट्स बेस्ट टू चेंज इट इफ देयर इज अ एक्सेस ऑफ स्वाइलिंग। इसके अलावा जब भी आप डायपर चेंज करें, एक जिंक ऑक्साइड एज बेसिक एज कैलामाइन लोशन जैसा आप क्रीम यूज कर सकते हैं, और बच्चे को हमेशा डायपर फ्री टाइम जरूर दें। इससे क्या होता है, एयर सर्कुलेट होती है, इट रिड्यूसेस द रिस्क ऑफ इरिटेशन। कमिंग ऑन टू द थर्ड स्टेज ऑफ लाइफ विच इज चाइल्डहुड। इस टाइम पे बच्चा रिलेटिवली एक्टिव होता है, बहुत ज्यादा स्क्रैच करता है, यू ऑलवेज हैव टू ट्रिम द नेल्स, दैट इज वन थिंग विच वर्क्स up to 50% in controlling all the skin, all the infections, because जब आप scratch करते हैं उसमें micro tear हो जाता है, again it calls for a lot of skin infections, the immune system is already on the weaker side. इस स्टेज पे एक्जिमा परसिस्ट कर सकता है, ड्राई स्किन परसिस्ट कर सकती है, कुछ पिक्यूलियर चीजें हैं जो इस चाइल्डहुड स्टेज में देखने को मिलती हैं। One thing which is very characteristic in this trisomy or Down syndrome is the angular cheilitis. Angular cheilitis मतलब जब आपके lips के angle inflame होते हैं. That one reason is बच्चा persistently mouth open रखता है because tongue is slightly larger, fissured, तो accommodate नहीं कर पाती है. When there is a drooling of saliva and there is a constant dryness, chappiness plus drooling, this adds on to this calls for candida infection. तो ऐसे में antifungal creams and time and again if you remove the crust, if you see the image quite closely, जब आपका एरिया बहुत ज्यादा वेट रहता है एंड फिर एकदम से ड्राई होता है तो वहां पे क्रस्टिंग हो जाती है। अगर वो बच्चा उस क्रस्ट को निकालता है या मैनिपुलेट करता है, वहां पे रॉ एरिया बन जाता है। सो ये एक साइकिल है, दिस इज अ विशियस साइकिल। As parents and caretakers, you have to be vigilant of whether or not a person has fissured lips. इसमें कुछ क्रीम्स हैं जो आप टाइम एंड अगेन 2-3 वीक्स के लिए लगाएंगे, इस एरिया को थोड़ा रॉ इरोजन्स को जल्दी आइडेंटिफाई करेंगे, तो कॉम्प्लिकेटेड कैंडिडा केसेस को हम अवॉइड कर सकते हैं। नाउ अगेन चाइल्डहुड में बहुत ही पिक्यूलियर आर्म्स एंड लेग्स पे इस तरह के बम्पी रफ स्किन आ जाती है जिसको हम केराटोसिस पाइलरिस कहते हैं, स्ट्रॉबेरी लेग्स एंड आर्म्स। Nothing to be afraid of, nothing alarming here. It's just a hair follicle, a superficial hair follicle infection. Lekin, this can be itchy sometimes. And again, repeated scratching may invite secondary staph infection or bacterial infection. This is easily manageable, sometimes with topical solutions, sometimes with some basic interventions, but this is not harmful and this is by and large non-infectious. So even if you touch it when you apply the moisturizing or the anti-inflammatory lotions, this doesn't spread across. Now coming on to alopecia areata, I think every one of us must be aware of how alopecia areata looks like. The diagnosis, although is very easy, presentation is very variable, but since this is an autoimmune condition, sometimes the immunosuppressants that we need to give, we have to find a delicate balance, because बहुत ज्यादा अगर हम immune suppressants बच्चे को देंगे, इम्यूनिटी ऑलरेडी वीक है, तो इन दैट केस एक सीरियस इन्फेक्शंस का रिस्क रहता है। इसीलिए दिस इज प्योरली कॉस्मेटिक। सो जब भी एलोपेशिया एरियाटा होता है, आपके इम्यून सेल्स आपके बालों के सेल्स के अगेंस्ट फाइट करते हैं। कई बार थायराइड और सीलियक जैसी डिजीजेस एलोपेशिया एरियाटा से एसोसिएटेड होती हैं, लेकिन अगर वो एसोसिएटेड नहीं है तो एलोपेशिया एरियाटा इज प्योरली कॉस्मेटिक इशू। यू कैन इवन लेट इट बी, although as the child grows, sometimes it impacts the self-esteem of child. So if it's a single patch alopecia areata, even the topical lotions, lagane wale lotions are just sufficient. Sometimes when it's let's say in the third image ये universalis category का हो जाता है, इस टाइम पे हमें एक immunosuppressants, oral suppressants की जरूरत पड़ती है। There are some good alternate to oral immunosuppressants, but वो सिविरिटी के अकॉर्डिंग या पैटर्न के अकॉर्डिंग आपको आपका डर्मेटोलॉजिस्ट डिसाइड करते हैं। Syringomas.
Doctor, we would request if you can just quickly, because I'm sure the parents are waiting to ask you a lot of questions.
Sure. I'll quickly. So most of these are visual illustration. मैं एक बार I'll just run it through and then switch to the. Shall I move ahead?
Yes, please.
सो सिरिंगोमास आंख के पास छोटे छोटे बम्प्स होते हैं जो चाइल्डहुड में बच्चों को बच्चों आई मीन इट अपीयर्स इन द चाइल्डहुड। ये भी हार्मलेस है, नथिंग टू बी वरीड अबाउट। इस एज में हमें, बिकॉज द चाइल्ड टेंड्स टू स्क्रैच व्हेन एट दिस स्टेज, बिकॉज ही और शी इज अवेयर ऑफ इट। आप इस स्टेज में उनको सोते समय हैंड व्हिच इज अ काइंड ऑफ ग्लव। इसके अलावा इस एज में आप बच्चे को ओमेगा 3 फैटी एसिड रिच डाइट ज्यादा दें, विच इज अ काइंड ऑफ अ स्किन बिल्डिंग फैटी एसिड। सो डाइट रिच इन ओमेगा 3 फैटी एसिड्स एंड एडिक्वेट हाइड्रेशन डेफिनेटली हेल्प्स। दिस इज द राइट टाइम जब आप बच्चे को सन प्रोटेक्शन एंड एसपीएफ इंट्रोड्यूस कराते हैं। दैट टू अगेन इट हैज टू बी फिजिकल सनस्क्रीन, नॉट अ केमिकल सनस्क्रीन। Quickly going to the teenage changes, what a teenage can undergo. Acne, sometimes it happen, but the child sometimes learn the skin picking habit. Painful bumps in underarm area may happen, and some added inflammatory disorder. I'll quickly go through the the adulthood phases. Now, this is very important to understand. The skin woes don't just end in teenage years. जब आपका बच्चा एडल्टहुड की स्टेज में एंटर करता है, because there is immune dysregulation and metabolic syndrome that is associated. Sometimes is acanthosis, like dirty neck syndrome. Sometimes there's a weight gain. Child is prone. I mean, when the adulthood phase comes, there is increased risk of diabetes and insulin resistance. So definitely an active lifestyle, good diet definitely helps at this stage. Some generic points which I like to reiterate is diet and hydration is very important. No matter what, clothing and fabric can make a lot of difference using right products. Sun protection, because there is a premature aging, which also is happening at the back play. Sleep, stress management, and regular checkups. So checkups, when I say checkups, I mean skin analysis and screening at dermatologist's office. It entirely depends upon the severity of the condition. You can, if the person has severe infections, monthly assessments, otherwise every 3 monthly assessment. And if the infection is not active, 6 months to annual checkup is what we recommend. Okay, what are the red flags? So, like I told you, not every dermatological manifestation calls for attention. But here are some of the important changes. If you see in your child, you must visit a dermatologist early on and get the diagnosis and treatment. Sudden onset of painful pus-filled lesion, which are progressive. Rapidly progressing rash, unexplained skin discoloration. If the child has so much itching that it is impacting his or her sleep, wound which is not healing within 2 weeks, you definitely should have a dermatological consult. Unusually abnormal looking moles, severe blisters, chale, peeling, and painful skin condition. And if the child has thickening or darkening of the skin with excess of weight gain, so this calls for attention. So I'll conclude it by saying that skin is a mirror and the armor of body, and we require extra care because a child with Down syndrome can have unique skin challenges. And as parents and caregiver, it's a crucial, they are at the central role here to identify these changes early on and not to trivialize the skin changes. I'd be happy to take all the question and answers. And if anybody would want to reach out to me personally for any recommendation, I would be happy to give any consult for free till the time we meet again at any of these organizations or camps. Thank you so much.
Thank you. Thank you so much, Dr. Priyanka. And we really sincerely appreciate about your outstanding presentation. You really explained the complex issues in such a simple language. We truly appreciate like medical practitioners like you who are willing to come forward and give their time and best expertise to empower parents. And we have already told the parents that we are open for question and answer. If you have any questions, one is just now popped up in the chat. I will read it as we are live on YouTube. I will read it for all the audience who are going to listen it later. It says, "Hi ma'am, will you please recommend any face wash or any ointment for face pimple for 12-year girl? Is it okay to use face wash or any ointment on face? If you have any suggestion."
Uh,
Thank
uh,
you also for that.
All right. So first, I would like to understand that can I give recommendations, like brand recommendations, or just the generic recommendations?
ये आप दे
I
सकते हैं, ब्रांड
I
रिकमेंडेशन
think
भी दे दीजिए।
yeah, generic
Absolutely.
will also do because the area they belong, whatever you prescription. I mean, I know Jisha remains in Delhi NCR, so that salt or that particular composition should be available there. That's the only thing.
Yeah, so generically, I can tell you some of the brands which have a dedicated pediatric wing, especially suited for people with atopic skin. So, Cetaphil is a gold standard brand. Cetaphil Gentle Cleanser is the gold standard cleanser which you can use in people with sensitive skin, in child with sensitive skin. It's completely safe to use ointment on the face, but ointment is a very generic thing. Ointment is much like a vehicle. Which ointment, which active you're using, that is very important. Uh, while I can recommend the salt, coming to the question again, is it for acne?
Yeah, she's asked for the pimples on the face and also a shampoo for dandruff.
Okay, so pimple on the face, like I told you, if it's a neonatal acne is mostly fungal in origin. In that case, the management entirely changes. Agar wo acne, if the acne is appearing in the teenage, it's
Yeah,
mostly
she's talking about 12-year-old girl.
okay. In 12-year-old, you can use a clindamycin based gel for the active red painful bumps. So, clindamycin is a topical antibiotic which has anti acne properties. Although it's a prescription medication, and if you overdo it, unsupervised use of clindamycin beyond 3 weeks can lead to resistance. Resistance in the sense that the same medication might not work if you apply it on, let's say, if it's not active acne. So, any red painful bump which is painful or in a 12-year-old, you can safely apply clindamycin gel on the active acne in the morning for around 7 to 10 days till it settles, and then you stop using it.
Yeah.
Talking of the shampoo, Sebamed has a good range of baby friendly shampoo. There is a brand called as Spoo shampoo, SPOO. It's again very friendly, and it's specially made for pediatric age group.
Yes. I hope that resolves Bindu's inquiry. The next question comes that my son is 13 years old and his hair are started turning to gray. Can you suggest or can you explain what is the reason?
So, like I told you, premature skin aging is a very characteristic of any chromosomal disorder because the body is somewhere lags behind in repairing all the UV damage the skin and the hair undergoes. Uh, Having said that, graying of the hair is a multifactorial concern. Sometimes it's genetic, and in a person having two, three factors combined together, graying is a very common occurrence. There is not much we can do. There is no well controlled study or evidence which says that this particular medication can reverse the graying. Although you have to look for confounding factor, especially the nutritional deficiency the child may be having, vitamin B12 deficiency. If there is genetics, there is a chromosomal disorder, and there is on top of that a nutritional deficiency, especially B12 or D3. This can accelerate the graying of the hair. So, better would be to get a test done. If you correct the nutritional deficiency, that's not going to reverse the graying of the hair, but that may definitely slow down the progression.
So the next question says that मेरा बेटा 10 साल का है, उसके प्राइवेट पार्ट के पास की स्किन बहुत रेड हो जाती है और कट जैसा दिखाई देता है, उसके लिए क्या कर सकते?
See, as per the symptoms, this may seem like a case of the candidal rash, जो कि बच्चों में बहुत common होता है. So जो inguinal fold है, if you understand, this is constantly occluded. वहां पे circulation, because of the poor circulation, वहां का जो air का circulation poor होने की वजह से वहां पे candidal infection हो जाती है. I have to have a maybe a picture or an image to make a better diagnosis. So if that's possible, otherwise, I mean, empirically, you can try an antifungal cream. Although, as a dermatologist, as a doctor, I would recommend you not to follow hit and miss. Please show it to a dermatologist, or in fact, you can show it to me afterwards. I'll recommend the topical cream if needed.
हर्ष, आपको अपने बेटे को डर्मेटोलॉजिस्ट को ऐसे दिखाना पड़ेगा to एक्चुअली अंडरस्टैंड कि वो प्रॉब्लम रेडनेस क्यों है, ये डॉक्टर बोल रहे हैं. So the next question comes at अल्पोशिया बार बार होने से कैसे रोक सकते हैं? Any precautions?
हम एलोपेशिया बार बार होने से नहीं रोक सकते हैं क्योंकि एलोपेशिया एक ऑटो इम्यून बीमारी है. ऑटो इम्यून बीमारी का मोस्टली अंदर से कारण होता है. इसमें जो हम चीजों को कंट्रोल कर सकते हैं, जो फैक्टर्स कंट्रोल कर सकते हैं, वो सिर्फ स्ट्रेस है, अच्छी डाइट है, एक्सरसाइज. अगर बच्चा चाइल्डहुड और टीनेज में है, आपको कुछ ना कुछ फॉर्म में, किसी ना किसी फॉर्म में कोई एक्टिविटी बच्चे को इंट्रोड्यूस करानी है, एनी स्पोर्ट्स, एनी एरोबिक्स, जिससे आपका बॉडी का इन जनरल जो एक हार्मोनल इंटरनल माइल्यू है वो कंट्रोल्ड रहे. ऑटोइम्यून बीमारी का कैरेक्टर ही यही होता है कि वो आती जाती रहती है. यू कैन नॉट रियली प्रिडिक्ट कि कब वो एक्टिव है, कब वो पैसिव है. लेकिन जब एक बार आपको एलोपेशिया एरियाटा के पैचेस आते हैं, आप जब दवाई शुरू करते हैं, ट्रीटमेंट शुरू करते हैं, आप उसको एकदम से छोड़े ना, विदाउट सुपरविजन ऑफ अ डर्मेटोलॉजिस्ट. अगर आपकी बीमारी आधी कंट्रोल है और अगर आप एकदम से उसको बीच में छोड़ देते हैं, या फिर अगर आप खाने की दवाइयों पे हैं और आप उसको धीरे धीरे करके लगाने की दवाइयों पे मेंटेन नहीं करते हैं, चांसेस होते हैं कि ऑटोइम्यून बीमारी बहुत ज्यादा फ्लक्चुएट करती है. लेकिन अगर आप एक बार में एंटी इम्यूनोसप्रेसेंट्स का जो डॉक्टर रिकमेंड करते हैं उसका कोर्स अच्छे से करते हैं और मेंटेनेंस को फॉलो करते हैं, तो उसका फ्लक्चुएशन काफी हद तक कंट्रोल्ड रहता है.
So hopefully the parent has got the answer. So the next question said that my baby is 18 months old and which you covered, I believe, but the parent wants to add that his scalp has something like dandruff. Anything I can use for that 18 months baby?
18 months. So this dandruff is a generic term. Most likely, if the dandruff is white, flaky, or reddish with a reddish scalp, you can maybe have a partition and examine the scalp. This is most likely a seborrheic dermatitis. So seborrheic dermatitis is a wide spectrum of manifestation. It can present with a mild dandruff, or at the opposite spectrum, it can present with thick heaped crust. The solution is use a anti-dandruff shampoo suiting the a baby's age. Like I told you, Sebamed is a good brand. You can explore that. Sometimes, if the inflammation is too much, we have to use anti-inflammatory. I would definitely recommend you to visit a dermat, because first time assessing the severity is very crucial, and antifungal shampoo is just one part of it. There are a lot more in the treatment armamentarium of seborrheic dermatitis. Sometimes shampoo is just enough. Sometimes we do have to follow an aggressive course for at least 4 weeks.
So the next question says that what can we do for rough and brittle nails?
Okay, rough and brittle nail is again could be multifactorial, mostly nutritional. इसमें biotin and some of the multivitamin, which is again B complex, उसका nails, skin और hair से बहुत direct connection है. I recommend. May I know the age of the child?
12 years.
12 year. At this age, I wouldn't recommend any active oral supplements. Just stick to a good antioxidant and vitamin B rich diet. You can have add lot of berries, blueberries, strawberries, flax seeds, nuts, almonds, walnuts. So all these things are loaded in vitamin B complex, right? And once you have brittle nails and you follow a good diet, it takes around 4 to 6 months for the next set of nails to come as a healthy nail. You can't reverse the changes which have already happened, because आपके if you see यहाँ पे एक नेल की रूट होती है जहां से आपका नेल बनता है, एंड यहाँ से लेके आपके टिप ऑफ द नेल को पहुंचने में 6 महीने लग जाते हैं. अगर स्लो माइलस्टोन्स हैं तो 6 से 8 महीने लग जाते हैं. So you can't really reverse it, but you can control it to some extent with dietary modification at this age.
Okay. So, of course, they again want to know about your contact details, which doctor has already shared in the last slide of her presentation. You can visit our YouTube channel for that, or we will request her to put in the chat box.
Right.
Dusra, they want to about add, this parent is adding to that 18 months baby's parent, that his skin of palm feet are very rough, and is case or sometimes it gets yellow, but hemoglobin is 12.3. I mean, they must have understood.
Okay, so yellow skin could be two things when we talk of palms and soles. One thing is keratoderma, which is not typically, which has no connection with hemoglobin. जब आपका स्किन का टर्नओवर स्लो होता है तो स्किन एक्सफोलिएट होने की बजाय शेड होने की बजाय वो हीप अप हो जाती है, वो अंदर एंट्रैप हो जाती है. सो योर स्किन हैज फर्दर मेनी लेयर्स. तो ऊपर का लेयर इज एसेंशियली अ डेड स्किन लेयर. तो जब वो डेड स्किन लेयर निकलने की बजाय हीप अप हो जाता है, जो कि it is quite common occurrence in chromosomal disorders or Down syndrome. उसको keratoderma बोलते हैं. In that case, you have to use good moisturizer. You can so there is a wonderful brand called as Venusia Max. It's a great moisturizer for someone who is having the thick palms and soles and yellowish palms and soles. Other possibility is something called as कैरोटिनीमिया. सो हमारी बॉडी में एक बाय प्रोडक्ट होता है जिसको कैरोटिन कहते हैं. वो कैरोटिन जब जरूरत से ज्यादा डिपॉजिट हो जाता है मोस्टली पाम्स एंड सोल्स में, तो palms and soles yellowish दिखते हैं. Could be either of these. Now what exactly it is, it definitely requires examination, but it is not something which is usually alarming. You can just stick to a basic moisturizer, making sure that the hands are not dry. बिकॉज ड्राई हैंड होगा तो वो बार बार हैंड को या बॉडी को सिग्नल करता है, स्किन को और थिक करता है.
So there is a big question, so I was trying to read that out. I'm so sorry. I think parents has got the answer rightly mentioned, and that cream we have a close experience with it, as in the one of our conferences we had distributed those Venetia creams also, and it is really a good thing which is repeatedly advised. Ma'am, this is a question came to me direct in message. I'll try to read. There are certain terms I might not read correctly, but I know being a doctor from that area, you'll understand. So it says, ma'am, good evening. There is a red spot in little finger from past 3 months of my 4.6-year-old boy with DS. He had severe viral flu and frequent diarrhea and pneumonia and dry skin, dandruff, black pigmentation on armpit and finger folds, and cracked nails on bigger toes. No thyroid issues so far, tested every year, no celiac disease, but has GERD and regurgitation. And birth history, 2 episodes of hypoglycemic shock and desaturation in day 2 and 5 due to lack of feeding. Restricted at hospital, and feeding began only after 48 hours of birth with Neolecta and then Neocate formula, as he could not tolerate Nanpro and Similac. So anything you can advise to this parent?
So if I understand it correctly, the question here is of the red lesion on the finger, right?
Yeah.
Ma'am, I would request if I can get a picture, maybe, because red thing could be 100 of the things. It's really guesswork.
Yeah.
And sometimes when you have one presentation and a lot of other comorbidities parallelly, we have to really connect the dot. It could be the presentation, just a skin manifestation of that particular disease, or it could be something entirely different.
Yeah. So Arvind, you need to show your child in person to the good dermatologist. If you are in Delhi NCR, you can very well go to V6 clinic. The next
Right.
question, we are already overshooting time, but there's one more question and a picture also in the chat. Arvind has put a picture, but he has put me directly. Arvind, can you put it for everyone? I don't know how to. I'll try to download it and show if I can. By the time I'll read the next question. Hi, ma'am. My daughter is 9 years old and she has very dry and rough skin. And the scalp on head is also very dry and has white hard scalp scattered here and there. Any advice for me?
So again, this could be all the things that we just discussed. Dry skin is a very common occurrence. Please review. I mean, if you can have the excess of the presentation, there are some do's and don'ts. If you follow those do's and don'ts by heart, half of the problem will be solved, because these, I mean, the child typically has immature skin barrier. So any repair-based molecule, like I told you, Venusia, Sevamil, and Cetaphil are the gold standard brands. You can use their thick cream-based products for your child, as long as the dry skin is there. And sometimes as the child grows, dry skin tends to get better. Talking of the scalp, Sebamed shampoo is good enough shampoo. Spoo shampoo, like I recommended, it's a good enough shampoo. You can try using it twice a week and see if it makes a difference.
I think this is the red lesion, ma'am. The parent was talking about in this.
Okay. How old is the lesion, if I may ask?
Um, I'll just check the chat. I have to stop share.
2 months.
From past
He's
3
saying
months.
2 months.
Okay.
Sorry?
2-3 months, ma'am.
2-3 months. So if it's not progressive, it's going to come off in another 3 months because this seems like a splinter hemorrhage. So it's like blood entrapped underneath. Now, what is the reason? What could be the initial cause? Is something that needs to dig. I need to dig in a little deeper. If this has been there for 3 months, not progressing, as the nail grows out, it's going to come off. The only thing which should be observed is if new such lesions appear in coming times ahead. That calls for attention because that means that whatever pathology has caused it, it may happen again.
Okay. So it can be an external injury also because of which it happened and so.
Mostly it's beneath the nail and it
Yes.
gets trapped as a subungual hemorrhage, we call, beneath the nail when the blood entraps. It doesn't come out at its own and it's nothing to be of a worry. It's going to come off in next 3 months. Please wait for 3 months. Be patient. I'm sure it's going to come off. If new such lesions come, then it's a matter of worry. Then you can connect with your dermatologist, or in fact, I would be happy to help and observe.
Yeah.
अपेक्षा अब हम
A
अपना
lot of
आखिरी
questions.
सवाल लेंगे
Yes.
कि जब वृंदा जी स्क्रीन पर दिख जाती हैं तो इसका मतलब ये है कि हमारे जो है
Yes.
प्रोग्राम की समाप्ति का समय आ गया है. हमें डॉक्टर रेखा को भी सुनना है जाते हुए.
1 minute.
Absolutely.
I think, Sammy, I think you take
There's
these
one.
3 questions. Kalpana
Yes.
here has got a question.
Yes. Kalpana's the question I was reading.
Ma'am,
Uh,
excuse me, ma'am. I'm also having one question, please. Ma'am, actually,
Wait for your turn, ma'am. That's why we said that the moment she was coming to the last slide, that keep ready your questions because the build-up comes towards, we have already exceeded time. So let me read this question. This is very important. This says, hello, ma'am. My son is 18 years old and he gets red pump, which later burst with watery discharge. They mostly occur in areas where body has folds like armpits, below tummy. I have been using fusidic acid cream, but it reoccurs. I also use candid powder. What will you advise?
Okay, so the kind of presentation that was just mentioned here is very classical of something called as impetigo in a child. It's almost invariably a bacterial infection. Fucibit is a mix of both the things. It may help, but just one part of it is that it's there that actually is going to help. Although again, it's very empirical because as long as I don't, I have to see, I don't see it. It's all a guesswork. I would recommend to use a mupirocin ointment for 7 days whenever it happens. It is happening because there is a constant recurring bacterial infection that is happening. Again, it's common. You have to make sure that the skin barrier is restored and skin is not breached. So, and whenever if your child is tending to scratch it or at randomly places, this is a perfect portal of entry for recurrent boils or recurrent blisters of this sort. Impetigo is what we call it, is usually bacterial. Candid powder or any antifungal powder is not going to help. In fact, I would advise you against using the candid powder on the underarms and on the inguinal area because it mostly
Yes.
it cakes up and it makes sometimes the healing process little slow. So it is given whenever it's needed for a short time, not like as a generic powder to use in your child.
Okay. So how about nose की skin बहुत dry और reddish हो जाती है पर अपने आप ठीक भी हो जाती है कुछ recommend करेंगे आप
Nose की skin, right?
Yeah, nose skin, yes.
So that is again a part of dermatitis. अगर वो अपने आप ठीक हो जाते हैं, you just have to stick to moisturizer and lifestyle modification. आप ये पैटर्न नोट कर सकते हैं कि कौन से वेदर में ये ज्यादा होता है. अगर ये विंटर्स में ज्यादा होता है, it's most likely because of that excess of moisture being taken away or being ripped off by the sudden change of temperature outside. तो उसमें always make a note that your body's, I mean child's body's temperature should not fluctuate. So एकदम गर्म और एकदम ठंडा टेम्परेचर, लाइक एसी से बाहर जाना, बाहर से एसी में आना, और यूजिंग डायरेक्ट फैन. AC is always a preferable mode of cooling as opposed to fan, क्योंकि fan एकदम dry out कर देता है. So sudden fluctuations have to avoid it. Otherwise, I don't think at this stage बहुत active medication की जरूरत है.
Yeah. So my son is 23 years old. Sometimes we find white circular patches in 2 and 3 areas of skull. He's taking thyroid medication, but regularly. But please advise.
White circular patches of hair loss, if I understand it correctly.
Hair loss is not mentioned in the question. Bindu.
Ma'am, it's not hair loss. Some white circular patches will be appearing in and around, I mean, on the scalp, like dandruff, but it is not dandruff at all. But it looks like a dandruff infection.
Okay. So in conditions like this, जब आपको एक डैंड्रफ जैसी चीज दिखती है स्कैल्प पे, लेकिन वो एक छोटे एरिया में होती है, much like what you described, could possibly be scalp psoriasis, because psoriasis typically has a nature of very well defined dandruff looking plaques. So please visit a dermat, because only dermatologist can make a right diagnosis. Treatment more or less would be centered or on the lines of how we treat dandruff, but then there are some other things which is going to make much difference, and then you can get back to your regular anti-dandruff shampoos.
Yeah. And if Cetaphil cream doesn't work for the very dry skins in winter, and also if you can recommend something for the fissures at the mouth, as you mentioned.
Could you please come again? I couldn't catch the first line.
Any other cream if Cetaphil also not working for the dry skin in winter?
You can try Venusia Max variant. That's a good one. There is another, if the child has active dermatitis, there is Etogla Resil. It's a formulation which is specifically made for people with dry atopic skin. So there are two good brands, Venusia Max, Etogla Resil. It works when other fails to work.
So how about that strawberry kind of a skin and buttocks? The sister is asking on behalf of sister that my 16-year-old sister gets acne type of blackheads like strawberry skin on her buttocks. She has thyroid, but it is stable. What would you recommend for her?
So if it's active, if it's red and itchy, then we need to add something like Fusibit cream for a short while.
She's mentioning blackheads kind of a thing, so there's no redness.
Okay, so I'm assuming it's in the healing phase or the stage 2 of the keratosis pilaris. There, 2-3 things work. You can use the urea-based creams or moisturizer there. One good brand is Zarina. Zarina is a urea-based moisturizer, which you can use, that typically settles it down. Although if the blackheads are too big, that means that there is whatever the hair secretes, which is much like sebum or oil, it gets entrapped in it. If it's bigger, if it's troubling, then sometimes we have to give a nick and poke it out. Otherwise, Zarina cream you can try for a month if it works, or get it evaluated with a dermatologist.
And anything you want to advise for the teenager who have truncal acne problem on their chest and back and everything?
So truncal acne.
Okay.
Truncal acne is a very common occurrence once the child enters a teenage phase. You invariably need to have some or the other oral medications for truncal acne, because truncal acne बहुत ज़िद्दी होते हैं. Truncal acne, they do not go like that with the topical medication, because there's a lot of inflammation over a widespread area. If I have to give you over-the-counter advice for any topical, you can use something like a Sally Zap spray, which has got salicylic acid, which will control the oil and will prevent the occurrence of the acne again. But if those are big ones, painful ones, then definitely oral medications are the first line of treatment that needs prescription for sure. So I need to check what stage of inflammation or what stage of truncal acne your child is in.
Ma'am, it is not bigger one actually. Earlier he was having at his thigh also, and I was using Lupirocin. and I have given him doxycycline antibiotic for around 20-25 days, and after that chest pain he was having. Then doctor stopped that doxycycline and clindamycin. He told that mix clindamycin with the benzoyl peroxide 5%, and that mixing both, I started applying that. So,
Okay.
ma'am, now again truncal acne he is having, and itching kind of problem is happening on his back.
All right. So I wanted to know, did the benzoyl peroxide and clindamycin work for you for a short while?
Yes, yes, yes.
Okay. See, truncal acne is not something we can get rid of as long as the child's oil gland is active. And teenage is the age when there is a lot of hormonal stimulus. So if it's being managed and if you're able to manage it with clindamycin and the benzoyl peroxide combination, you can go ahead with that as and when there is a flare. I would recommend to use a benzoyl peroxide 4% body wash twice a week. So whenever, I mean, in the morning, you give the child takes bath, you apply that wash, make a lather out of it, uska jhaag bana ke, just keep it for 5 minutes on the back and on the chest, and then wash it off. So that works in controlling that active inflammation.
Yeah. It's really been very enriching, and so patiently you've been answering all the questions for our parents and giving us such a clear guidance to be vigilant about, all the skin concerns and manifestations. It will really, the clear do's and don'ts will be my takeaway from this. I mean, it will be really beneficial for our younger parents. That clear do's and don'ts really give us, very clear guidelines, right, Parul? I think we will
बहुत
not be able to
खूबसूरत
accommodate more
प्रेजेंटेशन थी।
questions. Yes.
और समीक्षा, मैं सोच रही हूँ इतनी खूबसूरत डॉक्टर को देख के इतने सारे सवाल लोगों को आए कैसे, मैं तो सारे सवाल ही भूल जाऊं ऐसे में। तो बहुत ही
One
सुंदर।
question here, Sammy. Doctor, can
Yeah.
you share your presentation with
Sammy.
us so that we can share it on our
Yes,
other media and
I
all
was
that?
I was about to ask.
Yeah, sure.
Ma'am, would you like to either
Can I
share
one
the
question?
screen once again?
Sorry, you want me to share the screen?
The last, because you mentioned there how to reach out to you.
Right.
Yes, Shubhagini ma'am, जब तक मैम शेयर करती हैं आप पूछिए, शॉर्ट में छोटे से में आप अनम्यूट कीजिए।
Thank you to all. मैम, मेरा बेटा का all hair fall down till 4 years हो गया। वो क्या स्किन का प्रॉब्लम है क्या? मैं समझ में नहीं आती। स्किन डॉक्टर को लिया था, वो पूरा स्टेरॉइड दे दिया था, इसीलिए हम बंद किया है। और अभी थोड़ा थोड़ा आगे पीछे थोड़ा थोड़ा आ रहा है, लेकिन क्या प्रॉब्लम ऐसे मैं पूछना चाहती हूँ। ये क्या स्किन का प्रॉब्लम है या थायराइड का प्रॉब्लम है या मेंस्ट्रुएशन भी बंद हो गया, 5-6 साल हो गया? क्या प्रॉब्लम है मैम, मैं जानना चाहती हूँ।
Okay, ma'am.
Hair fall, completely hair
ये
fall.
एक हेयर फॉल है। ये एक ऑटो इम्यून तरह की बीमारी होती है, काफी कॉमन होती है, जिसको एलोपेशिया एरियाटा बोलते हैं। ये वैसे भी इन जनरल पॉपुलेशन में देखने को मिलती है। तो ये समझ लीजिए कि आपके जो सेल्स हैं, आपकी बॉडी की जो कोशिकाएं हैं जो इन्फेक्शन से लड़ती हैं, कई बार वो बालों के अगेंस्ट काम करना शुरू कर देती हैं। अगर ये बच्चे को, इसमें कोई अंदरूनी प्रॉब्लम नहीं है, अगर आपके बच्चे को एक बार बेसलाइन थायराइड चेक कराना है, अगर थायराइड नहीं है तो ये कोई खतरे की बात नहीं है। ये ऐसा नहीं है।
थायराइड कंटिन्यू करती है मैम, और 40 बेटी को 42 ईयर्स हो गया। लेकिन क्या प्रॉब्लम है? मैं बर्तन अभी नाउ आई एम एट दिल्ली होगा, आप कहाँ पर होगा तो हम
ये
फिर
देखिए आप
डॉक्टर को
स्लाइड,
दिखाएं।
शुभाग्नि मैम ये स्लाइड नोट कीजिए जो मैडम ने शेयर किया है, वो यहाँ बैठती हैं, गुरुग्राम में है, आप जरूर जाइएगा इनके पास। रेखा मैम, we come to you. What do you want to say? We have already exceeded a lot of time. Unmute ma. Ma, you need to unmute. You can't hear you.
And Doc could kind of close her session if it's okay with her.
No, it just like Parul said, I have no words to say because I'm looking at her and thinking to myself that that is what everybody wants. They want her skin and her hair. Now, this is not going to happen. So keep smiling. And Priyanka, honestly, it was a very, very, very clear. And I think more than anything else, we were able to digest your information. I could also tell you that I think skin is one area which worries everybody. You know, cosmetically, none of us want to look different. But I think for my parents, for the last, I think recently, the last 1 week, the number of questions that came up on skin, we necessarily had to bring you guys, and you were so good about it. You offered to make that presentation.
Thank you.
So it will happen repeatedly, because this is not, like you said, infancy to right to the end. We want our children to have clear skin. We want them to be, you know, like, the word autoimmune is used very easily, but nobody understands it. So I feel for my parents when we use big words, like, how will a person from a village ever understand why I have rash? Or why is it that my child is breaking up in all these things? If you say autoimmune for a person whose hair is falling off, like last week, I think this was the reason we had to get you, was everybody started saying our hair is turning gray. And at 12, 13, you want to preserve the hair. So I think we are going to use your services and call you more frequently. One thing I want you to talk about, Priyanka, the next time is hygiene.
Sure, ma'am.
See, I think it all stems from hygiene more than rubbing all these creams, because our children definitely have excess fat.
Right.
And obesity is a part of it. So what happens with the folds? They're only using candid creams and powders to try to keep it dry. No, we need to explain to them that, and because we are insisting that everybody gets into sport also. So with sports, you will sweat in India. In India, we have no other options. So what do I do to protect my body against sweating? If I sweat, how many times can I have a shower? How do I keep my skin clean? Pubic hair, very big question that comes up all the time for us. Do they shave often enough? What happens when, you know, because I've seen when they shave, they have all these type of rashes. So I don't know, we need to advise them correctly so that we have like a male skin and a female skin. And I think we need to generalize this by saying everybody might have the same, but still they have different issues. And well, thank you so much. And girls, put your hands together to one of the most beautiful women. I mean, we should have a fashion show for you.
Thank you.
So looking forward to, doing such more sessions, and it is so gratifying that I could make a difference.
The only thing is, Priyanka, when is it possible for them to get in touch with you? And is there a slot that you could give our parents at a concession?
So anytime. So I put in my number. It's actually my office, my clinic number. I have my assistant, my front desk. I'll definitely ask her to attend to anyone who's reaching out to me on priority. So that is doable.
Girls, put your hands together. We don't get people like this so easily.
Absolutely.
Thank you, Priyanka. Remain young and beautiful. We love you. Thank you.
Welcome to the folds, and be prepared. You are getting, a lot of queries. A lot of parents are going to visit, and we are going to call you again, again, and again at this platform. Of course, in person also.
Sure.
See you
So
soon.
looking forward. Yeah. Thank you
so much, everyone. Thank you,
Thank you,
Ma.
thank
Thank you,
you.
Parul.
Thank you, Dr.
बहुत
Priyanka
सभी का
ji.
शुक्रिया। और जाते जाते
Thank
रेखा
you,
मार्च
ma'am.
मार्च के लिए हम कुछ सुनना चाहते हैं ताकि हमारा उत्साह बने और बरकरार रहे। और कुछ एक चीज मार्च का उत्साह बनाने के लिए माँ आप कह दे।
Yeah, I mean, you know that Parul and Sammy, the whole world keeps talking about after me what? I want us to appreciate those who are serving us. And when I say serving us, it could be the medical fraternity, it could be people, it could be your neighbors, it could be your friends, your siblings, bring everybody onto the thing. We have 31 days when we can splash them, talk about them, and say, we love you guys for being there. Because if you do not create that caregiving community, you are the ones who are going to suffer. Don't talk about what after me, because I believe you create a community, and serve them. You be good to everybody. My point is, it's a two-way street. It doesn't happen. You have to be good to everyone. Ask for it, get it. Everybody wants to serve you. Look at Priyanka. Thank you all so much. God bless you guys.
Thank you, Brinda ji.
Thank you,
Thank
Dr.
you,
Priyanka
thank
ji.
you, thank you, thank you so much, Priyanka ma'am. It was an amazing session. We really, at
Thank
least
you,
we
Brinda
understood
ma'am.
what
Thank
we
you,
did.
Rekha ma'am.
So it's
Namaskar,
easy.
Rekha ma'am.
Thank you, Sammy and Parul and Deepti for being there. And see you all next week.
Yeah,
I'm
see you
ending the
soon.
session.